Hi everyone, I'm Alex with PCRI, and we are here to ask your questions to our prostate cancer expert, Dr. Mark Scholz. He's also our executive director. If you have a question that you would like asked in the future, you can go ahead and email us at info@pcri.org, and for more information, visit our website. All right, Dr. Scholz, today we're talking about leakage, so effects after prostate cancer surgery. And this is a huge topic, and we're really excited to hear your answers. So this is really, what do we do about leakage after prostate cancer surgery?
Big problem. The problem with urinary incontinence comes in a lot of different degrees, and depending on how serious it is, there are different solutions. The starting place, of course, if someone's had recent surgery, is to hope that just time will improve the situation and it will resolve over a period of a few months after the surgery's been completed. The ways to try and enhance or improve that process is to implement Kegel exercises. That's the strengthening of the muscle, the sphincter muscle, that controls the urine flow. There's a right and a wrong way to do Kegel exercises, and some of the urologists actually do biofeedback, helping patients learn the right way to squeeze the muscles in a fashion that they build up their strength and get a quicker recovery. So the Kegel exercise is a starting place for everybody, and they also work for people that develop incontinence when they get older. Maybe they never had an operation, and people can look online and get some more details about what a Kegel exercise actually is. The next level, of course, is some sort of medication. There are anticholinergic pills that can reduce bladder urgency and bring about bladder control in people that have relatively mild degrees of incontinence. And these are medicines like Enablex, Vesicare, Myrbetriq. There are other products out there as well. And they can be helpful. They're not miracle drugs for people with serious incontinence, but they do help people that have marginal degrees of incontinence. And it's always nice to try a pill and see if that's going to be helpful, perhaps in conjunction with the Kegel exercises. The problem with anticholinergics, not Myrbetriq so much, but the other agents, is that they can cause dry mouth, sometimes some issues with fatigue and constipation. So not everybody tolerates them super well. The next level of intensity, of course, is to go visit a urologist and talk about the placement of an artificial urinary sphincter. This is a surgical procedure where they implant a small inflatable cuff around the sphincter, and this is controlled with a switch in the scrotum. And the sphincter inflates automatically and then deflates for urination with pushing on a button in the scrotum that's placed in the scrotum. It's a fairly big operation. It's very delicate. You're working in a previously operated field. And so that operation really needs to be done by doctors that have dedicated themselves to learning that particular operation. It's not an operation that just any urologist can do. You want to go to a specialist that's doing this operation over and over several times a week, has developed the skills to be able to get good results. Studies seem to indicate that the artificial sphincters are successful in about 85% of people. So it's not going to work for everybody, but the majority of men will get a notable improvement with an artificial sphincter if it's put in by a skillful doctor.
So with the artificial sphincter, is that something they'll have for the rest of their life? Do they have to get parts replaced eventually? Like, how does that work?
Yes, it is for the rest of their life, and there is a concern that over a period of years that mechanical malfunctions can occur, and some of these men will be in for another operation down the line to upgrade it or to fix it. But I've known men that have had them for over 10 years without really any complications.
Okay. And regarding leakage after surgery, is there a certain point before Kegels and all these, options you've talked about come into place? Is there a certain period where if they've had surgery and they still have leakage after a certain amount of time, then this is when they need to start really paying attention to doing these? Or should they do it right after surgery to begin this process as far as Kegels and maybe these pills?
Yeah, actually some surgeons advise their patients to start the Kegel exercises before the surgery to build up the muscles. And I'm not quite sure how effective that is, but I do know some doctors are advising their patients to do that.
Can the average everyday urologist, are they aware of these pills and they're pretty standard and patients can go talk to them about it?
I think so, yes. It's a super common problem after surgery. And so the urologists that are doing radical prostatectomies are familiar with these steps. And I think many of the urologists are going to be willing to offer an artificial sphincter and think of themselves as competent to do it. But because it is a tricky operation, I would advise seeking out a urologist that's developed a dedicated skill just to doing artificial sphincters.
That makes sense.
Yeah.
Regarding the tolerance of the pills you mentioned, is there anything to help mitigate the side effects, like dry mouth or any sort of fatigue or anything like that? Is there anything that the patients can do?
Reduce the dosage, take a smaller amount. Sometimes you can switch to one of the other products. One product may be better tolerated by one patient, but the level of satisfaction with the pills is not high. I mean, they will help some people and they're worth a try, but we don't get consistent good results that we would expect everybody to get better with the pills.
Thanks for watching. If you have questions you would like us to ask in the future, you can go ahead and leave them in the comments section below. If you liked today's video, give us a thumbs up and subscribe to our YouTube channel so you can stay updated on all of our latest videos.